Good afternoon, everyone. It's 3 o'clock. I'm Marty Bailey, the director of the Sibley Senior Association of Community Health. Thanks to each and every one of you for attending with us today. We're very pleased to be able to welcome you to our first virtual senior town meeting. As many of you know, the Sibley Senior Association is a community wellness program for people over 50. We have over 7,000 members. Membership provides access to many special benefits, including consults, screenings, recreational activities, classes, seminars, special benefits, including screenings and support groups and more. We hope to continue to serve you in person as soon as this pandemic is over. Sibley Memorial Hospital is a member of Johns Hopkins Medicine. Johns Hopkins Medicine is one of the world's premier integrated health systems. It has 6 academic and community hospitals, 4 suburban healthcare and surgery centers, over 40 patient care locations, a home care group, an international division, and it offers an array of healthcare services. We're using our expertise to address the coronavirus pandemic, treat patients, protect visitors and staff, and provide up-to-date information to the public. That's why we're here today, to make sure you have the information that you need in this unprecedented time. Before we get started, I'd like to express my sincere appreciation to Dr. Jennifer Abley, Sibley's Interim Chief Medical Officer, Dr. Erica Richards, Chair and Medical Director of Behavioral Health at Sibley, and Dr. Tilly Williams, a naturopathic physician and founder of the DC Wellness Institute. Thank you, each of you, for taking the time to join us today. And in today's meeting, we're going to focus on mental health and emotional well-being for seniors in the time of COVID-19. We're going to include an update on COVID-19 in DC, how to deal with depression and isolation, and self-care tips for well-being. Thank you to those who have submitted questions in advance. I would like to let you know that this is a webinar format, so you are muted while the panelists are speaking. And we have received some questions in advance, so we will be using those to answer some of your questions today. Dr. Abley is going to kick us off with an update on COVID-19. Dr. Abley is an interim chief medical officer and chair of the Department of Emergency Medicine at Sibley Memorial Hospital. As chief medical officer, she oversees safety and quality metrics and performance. She's a board-certified emergency physician and fellow of the American College of Emergency Physicians. Dr. Abley received her medical degree from George Washington University School of Medicine and Health Sciences and completed an emergency medical medicine residency program at Harbor UCLA Medical Center. She earned her Master of Business Administration and Healthcare Management from the Johns Hopkins University Carey School of Business. Dr. Abley, thank you so much.
Wow, thanks, Marty, for that warm welcome. I appreciate it. And good afternoon, everyone. I just want to take some opportunity to talk about the kind of coronavirus or COVID-19 update in our area. I was thinking about what to say to everyone yesterday, and I was thinking, reflecting, on myself. I'm talking about coronavirus all day at work, and then I drive home and it's on the radio, and I get home and it's on the TV. And sometimes I feel like that's all that we're talking about these days. And with so much focus on it the past few months, I was trying to think, well, what would be new information that you haven't heard already? Because there's a lot about coronavirus that we don't know. So I'll take a stab and hopefully not be repeating a lot of information that you've already heard. I did read the questions that were submitted to Marty, so I'll try to go through some of those during these few minutes. So one of the biggest questions I was thinking about that you might have is really whether cases in our area are increasing or decreasing, and when we're going to really see our peak. And this is a question that we talk about a lot here in the command center. And there are a lot of different models that are being used throughout the country to try to predict where our peak is. And as you can imagine, as we implement things such as stay-at-home orders, those models then have to change in response to that. So we're chasing our tails a little bit as we try to keep up with current information. So we are still seeing an increase in cases in DC, but certainly the spread has slowed. We see that, I mean, the social distancing measures have made an impact. There are a couple of hotspot areas that are still in the district that are getting a lot of attention by DC Health. But in general, we've seen a slow in the spread. And that's important because of that term that I'm sure you all have heard called flattening the curve. So flattening the curve, just to reiterate, so when you think about the rate of infection, if a large number of people are getting infected every day and then they're continuing to transmit, you see a huge spike. So what we try to do is decrease that rate of transmission so that it slows the spread of the virus. And that's what we call flattening the curve. So flattening the curve helps give us time and resources to treat the patients who are infected without seeing a huge influx of patients that would overwhelm the healthcare system, which is kind of what we witnessed in Italy and in part in New York City, et cetera. In this area, we have not been overwhelmed in the hospitals. I think the hospital occupancy rate is about 78% in the district. What we've done in the district too is, is we cancel elective cases, we open up capacity. So we stopped doing a lot of other things so that we would have the flexibility to absorb and treat patients who were infected with coronavirus. And so we are not seeing that overwhelming that overwhelming influx of patients. And again, I think a lot of that is due to the measures that were put in place. It will be, a lot of us are anxiously waiting to see what happens as different parts of the country open up and people start coming into contact with each other more, and how that is going to impact the transmissibility, and if we will see kind of a second bump or spike in the number of cases. We're hoping that if everything is controlled and everyone is responsible and maintains social distance and wear their masks when appropriate, that we'll be able to kind of keep that transmissibility low. There were some questions about testing. There's a lot in the news about testing. Right now, we're mostly testing patients who have symptoms, but we do test everyone that comes in before a procedure, before surgery, because that has impacts on their procedures itself. And I think we'll see a lot of that testing increase. At Sibley, we actually have a test where a community testing tent where if patients have an order, they can be scheduled and drive through and don't get out of their vehicle to get tested. And I think that's important. Also, we're seeing antibody tests hit the market. So the testing tents and the traditional test is the nose swab. So antibody tests are coming out, and this is kind of still an unknown. We don't know what it means if you have antibodies against the disease, except that you have likely been exposed to it. That doesn't really mean that you're protected from getting it again. So we still have a lot of information that we need to get to see how protected are you. I will say that vulnerable patient populations still have to be very careful, even if they've already been infected, just because we don't know how much protection you will have. It's interesting, if you've ever had the measles, once you get the measles, you're pretty much protected for life. If you've ever had a common cold, that particular strain, you will typically only have antibodies for about a year, and then you can get it again. So it'll be interesting to see with time where this falls in on that spectrum. You've heard a lot about vaccine development, I'm sure. I don't have any new insight on vaccine development that isn't on the news. So we're all anxiously awaiting that. And, lots of different timeframes have been proposed. I personally am expecting it at the end of the year, beginning of next year. There were some questions about how to protect yourself in your daily life. And there's a couple of things that I can say about this. One is that I can't really emphasize the cleaning and disinfecting enough, along with social distancing. So cleaning is really taking stuff off of the surface. So when you clean a surface, you can remove some of the germs, but that doesn't kill the germs. Disinfecting is where you actually kill the germs. So which household cleaners and disinfectants can you use? So most of the things like Lysol, most of the things that have bleach, Lysol, ammonia products will kill the coronavirus. If you have any questions about the product, the CDC actually has a good website, and it's called the Cleaning and Disinfection for Household. It's that page, and it has a list of all the products that are approved by the EPA for disinfection. So it's important to kill the germs along with wiping them away. So you wipe them away, get the surface as clean as possible, and then you disinfect the surface. And it's important to think about things like doorknobs, light switches, handles, faucets, sinks, and especially our little electronics that seem to be at our sides a lot, our cell phones. In addition to that, there were some questions about what is safe to do in terms of getting outside. You know, although it was rainy the last time I saw outside today, hopefully warm weather and nicer days are coming. And we've all been kind of cooped up inside for a while. That's depressing, and it's nice to get out. It's nice to get some fresh air. So that's fine. I think it's important to get out and get some fresh air. I want to remind you that this virus is mostly transmitted through respiratory droplets. And that happens most frequently when people are in close contact. And so the CDC is defining close contact as within 6 feet of one another. So if you have a yard and you want to go out, yes, please go out in the yard, get fresh air, enjoy the nice breeze, enjoy the weather when it's nice outside. And then when you want to walk around for some exercise or to get a change of scenery, it's very important to stay 6 feet apart from everyone else. And that's a safe way to get outside. These are very interesting times, like none of us have ever seen before. There's a lot that's still unknown about the virus. So I don't have a lot of specific answers to questions because we still have a lot of questions ourselves. I don't see that this is a quick thing. I think that this will be around for a while. And the more that we can do to educate ourselves and to take steps to protect ourselves and wear masks to protect other people, the better. And that's it, Marty.
Thanks, Dr. Sibley. I have one follow-up question, if I may. Just to follow up, a person that thinks they may have exposure, may have virus, they need to contact their doctor to get an order. Is that correct, before they try to get a test?
Yes. So if someone wants to be tested, most of the community testing tents will require an order in advance, and the primary care doctors are very well versed at this point in time.
Great. Thank you so much. We appreciate you coming, taking the time out. We know how busy you are, so thank you for taking
Marty.
the time today.
My pleasure.
Dr. Sibley will be taking off to do her very important duties, and we thank her for her time. I'd like to introduce now Dr. Erica Richards. Dr. Richards is the chair and medical director of the Department of Psychiatry and Behavioral Health at Sibley. She is assistant professor of psychiatry and behavioral sciences at Johns Hopkins University School of Medicine. She I mentioned that she's the chair, and she's also board certified in psychiatry by the American Board of Psychiatry and Neurology. She's a member of the American Society of Clinical Psychopharmacology, the American Psychiatric Association, and previously served as a founder and instructor for the Research Assistant Clinical Training Workshop, a National Institute of Mental Health representative for the National Institutes of Health Clinical Fellows Committee, and a board member for the National Institute of Mental Health Fellows Committee. Dr. Richards.
Hi, Marty. Thank you for that introduction, and it's a pleasure to be here. What I'd like to talk about and spend some time discussing is mental health. And so I think Dr. Sibley's point, it's really important for us to understand what we're facing. Is there a timeline? Are there antibody tests? Can we get tested? And if so, how? I think that having that knowledge helps us kind of set marks in terms of path and finish line and the distance that we all have to travel together. But in addition to that, I want us to talk a little bit about mental health in general to understand, is this anxiety that I'm feeling, is this worry, is it more related to the circumstances right now? Or is there something else going on that maybe I need to pursue further? And I'm going to end with talking about coronavirus and understanding exactly how we collectively can cope with what we're facing. So let me start a little bit by just talking about mental health in general. And when I talk about mental health, I talk about 4 different aspects of mental health. The first that I talk about is diagnosis. What do we have in terms of diagnosis? Do I understand? Do I have depression? Do I have anxiety? Am I just adjusting to a certain situation? And so understanding that diagnosis is important because sometimes there are medications that are helpful. We'll talk about other treatments as well. But in general, you start with that diagnosis so that you can understand kind of that treatment plan moving forward. We have to talk about behaviors. And I want to take some time talking about behaviors because I think it's important to mention now. When I talk about behaviors, I mean certain choices that we are making. And that can be anything from, am I going to wear the mask when I go outside or not? But behaviors can also be other things. We talk about alcohol intake, alcohol consumption, drug use as another behavior. And it's important for us to realize that because there have been reports recently about people increasing their alcohol intake because they're home, because they're anxious, because they're bored. It can be many different reasons, but acknowledging that and understanding the things that are going on with us and trying to figure out why there are certain changes to behaviors will also be important. So when we talk about mental health, we talk about our diagnosis, we can talk about behaviors, we have to talk about life events. Certainly on everyone's radar right now will be the pandemic, but other things. Are you supported by family? Are you feeling more isolated and more lonely? Are you having stressors from friends? Are you having stressors from a partner? That sort of thing. And those life events, we have to understand how those also influence our mental health. And finally, of course, we talk about whether or not our personality is influencing how we're seeing the world, how we're interacting with others. So understanding those 4 components of mental health really help then us move forward in terms of what are the next steps that we need to do. Talking briefly about depression, we talk about what does that mean? What specifically is depression versus I'm having a bad day or I'm in a bad mood and those sorts of things. And when we talk about depression, we're looking for certain key things that are lasting for 2 weeks or longer at a time. We're looking for sleep changes. Now, of course, that can be changes in sleep where you're sleeping all the time. That can be changes in sleep where you're not able to sleep anymore and you're restless at night and you're up and down and that sort of thing. Look about interest. Do we still have interest in things that we like to do? Talk to our family, talk to our grandchildren, talk to our friends, read a book, that sort of thing, which can also influence concentration. Are you not reading because you can't follow? Are you not watching TV because you can't really pay attention long enough? So changes in concentration are also important to acknowledge. Any loss of energy, appetite changes, that can be the carb cravings, that can be not having an appetite at all. So any changes in appetite, we're looking at this constellation of symptoms where combined, and if you kind of can check enough boxes, we do want you to try to think about reaching out to someone. And of course, any thoughts about self-harm in any way, thoughts that you would be better off if you weren't alive, those are things that we want to take more seriously as well. Now, I talked about depression a little bit, and I really want to talk about generalized anxiety or anxiety disorders as well. And really what we're talking about when we talk about anxiety disorders, we're talking about really a persistent difficulty in controlling worry during a majority of the time. Is it okay to worry? It is absolutely okay to worry. Is it okay to have a bad day? It is absolutely okay to have a bad day, to feel like you don't want to be bothered, to feel like you want to stay in bed. What we're looking at, though, is does that dominate most of your days? These worries can cause a lot of distress, significant impairment in your ability to function during the day. When we talk about that, we're talking about, is there restlessness? Is there ongoing fatigue? Are you not able to concentrate? Are you more irritable? Are you getting headaches constantly? And again, are you having any of those sleep disturbances as well? And what we're noticing is as we age, what we're seeing is that in older adults, worry about loved ones really starts to predominate. So certainly worrying about your own health, but also worrying about the health of others. Is everyone else doing okay? And when there's that persistent worry that's really dominating your thoughts, we want to talk more about an anxiety issue as well. What we know from studies, there was one done, I think, in 2014 in Amsterdam. What we know is that the prevalence in older adults, now sometimes we're talking about older than 60, I know that that doesn't include everyone, but it can be as high as 15% of that population that's experiencing, that's going to meet criteria for some sort of anxiety disorder. Doesn't mean that you have to take medications for it, but it means that it needs to just be acknowledged. So if you are finding that persistent worry, we want to be able to acknowledge that as well. And it's important also to remember that there is this overlap. If I was able to show a Venn diagram, there would be depression and anxiety, and certainly some of those symptoms would meet in the middle. So just understanding that in terms of, is it okay to worry again? Yes, but are there other things that I should be looking for to know? And understanding that these symptoms change over time. When we're talking about teenagers, young adults, we're looking at anxiety related to being in school, anxiety around starting work and that sort of thing. And as we age, our worries and the content of those things change, but they certainly can still be there. So on the slide here, I have something that says factors that influence mental health. And if you don't have access to the slides, it's okay. I'm going to describe this for you in general. And when we look at the factors that influence mental health, we're looking at really the convergence of a lot of different things. So first of all, our physical health. How are we feeling? And I want to be mindful that even on this call, there may be some people that have either tested positive for coronavirus or had mild symptoms around that. So our physical health really matters. Similarly, people that have diabetes or high blood pressure or suffer from migraines, our physical health influences our mental health. So we have to acknowledge that. Number 2 on this list is relationships. How do those relationships that we have influence our mental health? And again, that can be a variety of people that we have these relationships with. The third is poverty. How are we doing in terms of finances? And it's important to remember that now a lot of people are struggling. We've heard in the news about unemployment rates and whether or not people are able to really pay their bills at the beginning of each month or at the end of each month. So that those worries, those financial worries, are also going to influence our mental health. Participation in mental activities is number 4 that I have on this list. And that's important because we've lost a lot of our ability to participate in what we used to think were meaningful activities. So I was speaking with someone this morning who really enjoys going to the pool and swimming. That was not only her exercise, that was part of her social connection since she lives alone and doesn't get out as much. And what's important to remember is that right now we've lost that. So how can we fill that void? What else can we do to really feel like we are participating in meaningful activities? And the 5th, of course, is discrimination. A lot of people, and that can take on many different forms. Some people feel that there's discrimination based on age. There's been a lot of concern about racial discrimination in terms of the people that are really dying from coronavirus. And it's important to note that that really affects us as well. And the more we see on the news, the more stories we hear about, the more that it can influence our mental health also. Now, if we go to the next slide, the other thing that we can talk about, and again, if you don't have the slide, I'll describe it for you. The other thing that we can talk about is depression in aging populations. And what we want to remember is that as we age, it's not necessarily depressed mood that we're seeing. It can be just worries. It can be the loss of energy. It can be that loss of appetite or those sorts of things. It can be pulling away from family, from friends, from wanting to be alone. Or it can just be not feeling well or feeling unwell for longer after we have a medical illness. And so those are the things that we really want you to watch for. My final slide, my final discussion that I wanted to talk about, the topic, is going to be on how does coronavirus affect mental health. And I think we've highlighted a lot of those things, but the one key thing I do want to say is there is potentially a lot more isolation. And if you're feeling that way, you are truly not alone. The question is, what do we do about it? And there are many things possible. Congratulations to everyone who is learning Zoom and how to download Zoom and how to get on talks, because this is one of the things. This is the time. You ever wanted to learn a hobby or learn a new skill? This is it. And once you learn it, you can actually share it with others. So finding ways to decrease that isolation is really going to be important. And to Dr. Abley's point, when she was telling you what you can and can't do, remember what she's saying about the social distancing. And so I have talked with several people that are saying, that's it, I'm done, closing my shades, closing my windows, not answering the door. That's not really, to the letter of the law, what you're being asked to do. You're being asked to be mindful, to put on your mask, to social distance. Can you go to your neighbor's door and knock and come out and with masked social distance? You can. And this might be the time that you meet new people and gauge other people's comfort level with doing things like that. You have to be smart. You don't have to be completely alone and isolated through this. You can also be experiencing this loss of identity. I was working before. I was able to take food to my grandchildren, once a week, and I'm not able to do that. What am I useful for? And we'll talk a little bit about how to answer those questions about other things that you can do. Same with loss of friends and family, and of course that increased worry that we discussed. And so coronavirus can look a lot of times like making us feel more isolated, possibly more depressed, but it doesn't really mean that. It means we have to shift what we're used to being able to do on a daily basis. So I think I should probably stop there, Marty, and that way you can take a few questions if you wanted to.
That's great. I have gotten a few questions, and to that point, I just want everybody on this town hall to know that we will address as many of your questions as we can, but we just won't be able to get to all of them today. We'll try to address others in the newsletter. Here's one. How can I support people in my community that have a variety of age backgrounds?
Oh, that's a good question. So the question is, how right, that we're targeting a certain age now, but what does this mean for other things? And for other people, for other ages, right? So we talked a little bit about maybe living alone or being isolated from your family. But if we were to do this, if I were to do a similar talk for, parents with young children, there would be an equal number of concerns, maybe in different realms. And so what we really want to do is still be able to support people in our community, our family members and friends. One interesting thing that I heard was a lot of times now that we do have people on Zoom and they can do these things, is reach out to someone that you know. Reach out to someone that you know that may have younger children. Offer to read them a book. You don't even have to be on camera to do that. You can be on a telephone. You can be on a flip phone. I know there's some people that still have flip phones, and that's fine. But just say, you know what? I'm going to give you 20 minutes without your children. If you can sit them down, I'm going to read them a book, or I'm going to use my video stream to have them, help me bake cookies or watch me do this art project or do this art project with me. So that homeschooling trend that's taking effect, really utilize that to help reach back and understand that there are people that are struggling in different realms. And the more that you can do that, the better. We talked about teaching a neighbor how to use Zoom. There are some people that are more disconnected from family members right now because they don't even know how to get it onto their computer. So if there are ways that you can do that while safely distancing, those will be other things where we kind of span the generations, but realize that we all have something to contribute to the other. With people that have neighbors that are aging, for example, adding something to your mobile grocery order or adding something they need to your grocery shopping would be helpful in supporting them, especially people with kind of those pre-existing conditions, from having to go out into the store for one or two things that they might just need for the week. So those are a few examples.
Thank you. Here's another one. How do I know if I'm just lonely or if I'm actually depressed?
So the question is loneliness versus depression, and sometimes it's very hard to tell. One of the things when I mentioned the criteria for depression that we as physicians use to really try to hone in We have something that's also called adjusting. Adjustment disorder is the official term, but really the intention is to give yourself time to adjust to a new normal. And that new normal can be many different things. It can be the diagnosis of a medical condition. It can be the loss of a loved one. In this case, it can be the need for social distancing. So it is normal to go through a range of emotions when you are adjusting to a new normal. What we're really looking for depression is, number one, if there's a pre-existing issue with a mood disorder, with depression or anxiety in the past, that can be unmasked more quickly when you are adjusting to a new normal. But we're also looking for consistency. I mentioned before, you're allowed to have a bad day, you're allowed to have a worried full day, and that's okay. We're looking for consistency. Is it lasting for 2 weeks or longer, most days and most of each day? That's what we're really looking for to separate those two.
Great. And then we have one more. All of the doctor's offices I know of are closed or only open to emergency appointments. How do I find mental health support?
Oh, okay. So this goes to treatments. And I didn't talk a lot about treatments. I want to mention what they are just briefly. Certainly, there are medications. Not everybody needs medications, but there are very good medications for depression, for anxiety, for other mood disorders. And in working with a physician, it can be a psychiatrist or a primary care doctor, an obstetrician, whoever you're able to speak with. Maybe there's a need for medications, but maybe there's not. And there are many people that do well with therapy in general. We've been doing okay in the field of mental health in some respects because we were able to transition relatively easy. I mean, I always prefer to see my patients in person, but we've been able to transition to video visits. And so there are a lot of psychiatrists, a lot of therapists that are now able to see you virtually. And that really helps because sometimes just talking through, is this depression or am I adjusting? Do I need medications? Do I need therapy? Understanding that really takes some of that anxiety down for everyone as well. So there are a lot of options. There is a website called Psychology Today. There are other websites that you can go through your insurance provider. Some take insurance, some providers do not, but there's a host of people that are actually opening up, and insurance companies are now absolutely, most of them are willing to pay for these virtual visits. So there is help out there if you need it.
Great. Thank you so much.
Thanks for having me.
Appreciate you taking the time out of your schedule today to be with us. Have a good day.
Thank you.
Now we have the privilege of welcoming Dr. Tilly Williams. She's the founder and director of the DC Wellness Institute. She offers a holistic approach in the development and implementation and management of wellness programs. Dr. Tilly is a health and wellness coach, consultant, and naturopathic physician with more than 35 years of healthcare service experience. Her programs provide all kinds of solutions, including health literacy, healthy behaviors, productivity, all different kinds of things. Dr. Tilly, we'd be so pleased if you would share with us now. You might have to let's see if we can get you unmuted. There you go. You should be all set.
Yes. Okay, great. Thank you for having me, Marty. I appreciate it. Well, I'm going to start off by saying, wow, life is a mystery. I was thinking when I was preparing for, for this town hall meeting, senior town hall, 3 months ago to the day, I was in San Diego, California, attending a continuing education class. And after my class, my roommate happens to be someone who went to medical school with me. And so we decided to rent bikes, and I reluctantly decided to rent a bike. Let me say that. She was very enthusiastic about it. Anyway, we rented bikes and rode along the boardwalk with the Pacific Ocean on our left, sun, clear blue skies up above, and really not a real care in the world. even though I did have a care because I hadn't been on a bike in about 25, 30 years. So anyway, we stopped at a restaurant because we liked the menu, and ended up running into someone, an old friend, an old honey, as a matter of fact, who I hadn't seen, neither one of us had seen, because we all went to school together, in 15 years. So, incredible. Why that weekend? He and his family lived in Tucson. My girlfriend, who's my roommate, lives in Seattle, Washington, and I live in Washington, D.C. So we all converged on that weekend. Why that weekend? Why that day? Why that restaurant? All of it chosen seemingly at random. So anyway, I didn't even want to ride a bike that day. So life is really a mystery. And you just never know what's going to happen or what will happen. There's a guy who is an author. He's a science fiction author. And he's credited with the quote of saying, "The mystery of life is not a problem to be solved, but a reality to experience." And we are in the midst of a real different reality now. One that, as the other presenters were saying, that we have not been in the midst of before. No matter what generation you're in, this is completely different. And, and so it's going to require some special adjusting, special skills, I think, to help to get us through this. There was a very excellent article on npr.org back in the end of March. And the headline of the article was, "Coronavirus has upended our world. It's okay to grieve." And the pandemic that has been spreading the globe has really not only left us, many of us, very anxious about life and death issues, but it's also having people struggle with a host of less obvious kinds of losses as we stay at home and wonder how bad all this is going to get. So it's important, the thing is, it's important to honor our losses, even if those losses are not as big as maybe someone else's losses are, like the loss of a loved one. We all have some losses. So often people who are physically well and haven't lost a personal friend or relative to the virus, they may not feel entitled to their own emotional upset over the disruption of their normal life. They might, well, who am I to say this? I haven't lost anyone that close to me. But yet it's important to honor our own losses, even if those losses are small compared to others. We can't heal what we don't have an awareness of. And so that's some of the things I wanted to talk about with us today, and acknowledging some things that are maybe going on with us as individuals. So to recognize some of those losses, social connections, and I think Dr. Richards was talking about, and so was Dr. Abley talking about the same thing. I think it's important for us to make a distinction between social distancing and physical distancing. We don't have to social distance. We don't have to not be, close in terms of communication with our loved ones and our friends. We just have to keep that 6 foot distance, physical distance between us. So that's a loss, though. The separation from close family and friends. For grandparents, all of our grandkids, you don't really get to see them like you used to, and you definitely don't get to hug or give them a kiss or get a hug back, so that's a loss. There's a loss of what we're calling habits and habitats, in terms of, you're no longer to engage in the usual habits and rituals that we engage in. So that is a loss too. And so a lot of times losing these things, it's like a shock to the system. We have a loss of assumptions and security. When we lose, it's a loss of a sense of safety. And by that, I mean that, you know, we have this idea, this faith that the sun is going to shine, you know, when it's not cloudy. We have, if we feel healthy, we have the assumption that we're going to get up the next morning. And so all of that has been thrown into havoc with what's been going on with the pandemic now. Trust in our systems. What about the government? You know, when the government, medical systems, stock markets, those kinds of things start to fail on us, fail to meet our expectations, then, you know, we're really thrown for a loop with that and don't know what we can trust anymore. You know, all of our lives, especially if we're seniors here, it's been a long time that we've been trusting in a lot of those systems. And then there is also a sympathetic loss for others. So if it's not a specific loss of a family friend or personal friend, we do feel for those folks that we know who have lost loved ones. You know, I know of several people, you know, not only within my distant family, but in the families of others that I know who have lost relatives and can't attend a funeral, can't have a funeral, so to speak. And so, you know, it's, you know, and then not being barred, once again, that's another thing, being barred from visiting relatives in a nursing home. That's also a loss for us. So, you know, let's maybe talk about self-care. How can we honor ourselves and our grief and losses at the same time? I think it's important to develop a routine. The routine includes healthy eating habits, physical activity, stretching, making sure we get enough sleep, those kinds of things. We can do things for ourselves, treat ourselves to a warm or hot bath or shower, listening to soothing music and singing along, you know, taking a nap, you know, and sometimes taking a nap, if you don't get the sleep that you need at night, as a matter of fact, you want to take a nap, because I think it's important here that we do all the things that help us to build our immune system, and getting sufficient sleep, eating well, and physical activity are amongst those things that help us to keep our immune system strong and healthy. So, you know, watch a movie, you know, maybe you want to, you know, check out Netflix or Showtime or some of the other streaming kinds of options that we have here with social media, well, with media anyway. One of the things that as we take care of ourselves during this time, you want to communicate. You want to keep those social connections intact. Call a friend. I know people who have had birthday parties on Zoom, who have had for 1-year-olds on up to 50 or however year olds. And it's, you know, it's not the same, but people are being creative about how they continue to communicate and touch base and be in another person's life as much as possible without, you know, without violating the rules or the request about distancing and things like that. So another way of self-care is to be creative. You want to write, you might want to journal, you know, and then in this journaling, it's not only just the writing down, but I think it's a good time now to kind of reassess our priorities in life. You know, there are a lot of things that we're not doing now. There are a lot of clothes we're not wearing now. There might be a lot of different things. Do we really need those things? I mean, is this a time to look at what we think is important? Because to me, there is an opportunity in this pandemic. There's an opportunity for us to create something different, something better, because it's not going to be the same. And that's not all bad. Another self-care tip is about meditating or deep breathing. If you're not a person who meditates already, it might be a little difficult to get started. There are all kinds of instruction on YouTube and online about meditating, but deep breathing is an incredible tool. I know working with a community that I've been in Ward 8, and we've been doing seminars and things like that with our residents in Ward 8. And I was given a presentation on blood pressure. And so we had someone put on a blood pressure cuff. They put the cuff on and their pressure read 178 over, it was like 92. And then we did 5 to 7 rounds of deep breathing, still with the cuff on, and we took it again, and their blood pressure had gone down to 138 over more like 80. I mean, so it made a huge difference, and that was just taking 7 or so deep breaths. And so you can imagine what it's doing to us. The anxiety inside, it's lessening the anxiety and bringing us and our bodies and our minds to a place of more calm. Movement, that's another self-care thing. You want to move. It doesn't have to be exercise. You don't have to be lifting weights during this time. I know a lot of people miss it who are used to working out at the gym and used to doing those kinds of things. But once again, you can still get outside. You can go running or walking, even dancing. I was speaking to someone who's with the American Heart Association, and they have a dancing, drop everything and dance. I think that's what it's called. I don't know. But several times a week where people can just tune in and they have someone on dancing, and then you just do it at home, and that can happen at home anyway. So you can act as silly as you want to at home. Nobody sees you, especially if you're there by yourself. So all of those things help to break the monotony, to give us something else to do. And also it helps the heart, and it helps us to create something that's not very routine and boring, because it can get that way if all you're doing is looking at TV or looking at a movie all the time. So you want to have some changes. I guess one of the other things is to be open to joy. Just be open. Let joy and gratitude into your life. One of the things we talk about with stress relief and stress management is keeping a gratitude journal. And with this, if you don't want to write it down, that's fine. But if you write it down, it's something you can refer back to. And before going to bed at night, I think it's a nice practice to look over your day and think about 3 things that you're grateful for that day. I'm grateful for Zoom. I mean, this couldn't have come at a better time, because we still have an opportunity and a way of communicating with each other that we would not have had. It would have just been the telephone, and nothing wrong with the phone, but Zoom has made a huge difference for us. And that's a nice game to do, not a game, but an exercise to do with kids. Say if you have your grandkids, and if you in your FaceTime of tucking them in at night before bed or whenever you see them, ask them what they're grateful for that day. They might say something like, I found a dime or something, but it's it's the thing that they're grateful for. So it matters not how small it is. And I think lastly, we want to be easy on ourselves. you won't feel like doing all these things every day, all these suggestions every day. Some days you may want to just watch TV. Another day you want to watch movies, or you might want to just sleep or do nothing. And it's okay. You know, instead of, I can't tell you how many times I've talked to folks and I say, "Oh, I'm just being lazy today." You know, because these are people who are very highly productive and they're used to getting a lot of things done in the day. And so I call them at a time they happen to be sitting on the couch looking at, looking at a movie, and it's like, "I'm just being lazy." No, you're not. You're taking a break. You're resting, you're recuperating, you're building, you're strengthening your immune system. So if we put it in more positive terms, I think it doesn't feel like we're doing something wrong. We can see the value, and as we see the value in what we're doing, we feel it. Our biochemistry will also be benefited by that, because we're looking at ourselves in a more positive light versus negative, lazy, strengthening the immune system, positive. So, so that for me, those are the kinds of things that that I think make a huge difference in terms of self-care. How are we doing on time, Marty? I'm okay? I don't hear you. You're muted.
I was muted.
Uh-huh.
So we're actually doing very well. I'm wondering if you have time for one question or clarification.
Sure. Mm-hmm.
Okay, great. So what would you say to someone who is normally really calm and a very chill person, but during this particular period of time, they find themselves overly worried during the pandemic? What would you say to them? How would you help them address the difference between how they normally are and how they are now?
Well, I would, first of all, Marty, what I would tell that person is to be easy on themselves, that it probably is the pandemic. It probably is the worry over the virus. And Dr. Richards was saying, was able to make those distinctions between loneliness, depression, what's normal and those kinds of things. But I'd say the deep breathing is probably the number one thing. Deep breathing or meditation is something that not only helps to physically lower blood pressure, but it absolutely calms the body, calms the mind, and somehow makes us think a little clearer about things. Taking walks, we have to be out in the sun. We have to be out in the weather and breathing fresh air. And that can be done safely. You can go out on your balcony if you have one. You can be out in your backyard, but you can also just take a walk somewhere, wearing your mask, and feel safe that it's safe to do that.
Thank you so much. We appreciate you coming and spending time with us today. It's been wonderful to have you.
Thank you. It's my pleasure.
Thank you so much. So everyone, thank you so much for joining us today. I do want to let you know that we at the Sibley Senior Association do have meditation classes that we offer. If you are interested in getting involved in one of those, you may call our office at 202-364-7602. I'm going to repeat that, 202-364-7602. We look forward to creating some other senior teletown halls for your participation, and we'll be getting the word out to you as they come up. Thank you so much for being with us today, and we'll see you soon. Oh, one more thing, if you haven't already gone, those questions we weren't able to address today, we will address either by newsletter, or for those of you who left your name and number, we'll contact you directly. Thanks so much. For those of you who might still be on, we will make it available for viewing later.